Good morning, everyone. I am Rahinka Gunawartana, Digital Learning Specialist at Edu Tech Private Limited. Edu Tech is the Sri Lanka's oldest and largest LMS developing company and also Sri Lanka's first Moodle partner. In today's webinar, we will discuss how to effectively utilize a LMS, that means a learning management system, for healthcare, knowledge retention and sharing. In here, we will discuss knowledge management in healthcare, how hospitals can protect what they know and why it matters for patient safety, staff retention, and quality of care. This is very important for HR managers and hospital administrators. What is knowledge in the health sector? Healthcare relies on two distinct types of knowledge, both critical to patient outcomes. First one, explicit knowledge. Written and documented. Clinical guidelines and protocols, patient records, standard operating procedures, training manuals. Second one, tacit knowledge. That means experience based intuitive. A doctor's clinical judgment, a nurse's instinct in emergencies, lessons from years of practice, informal problem solving. Tactic knowledge is the hardest to capture and the most valuable when staff. In here, you can see a iceberg. The knowledge iceberg. Most of what keeps a hospital running safely lies beneath the surface, invisible, undocumented, and at risk. Visible 10%. Written policies, records, and procedures, easy to store and share. Hidden is 90%. Experiences, intuition, and judgment, and clearly documented. And lost when staff. How knowledge moves in hospitals. Knowledge flows through daily routines, but without a system, it leaks away. Sharing, storage, and retention. The core problem is hospitals store data, not real knowledge. When experienced staff leave, their expertise leaves with them. Here we discuss problems of HR managers face every day. Staff turnover. That means knowledge loss. When experienced staff leave, their expertise walks out the door, undocumented and irreplaceable. Training gaps to untracked. Without a central system, it's nearly impossible to know how has been trained on what. Slow onboarding. New staff take too long to get up to speed without structured, accessible learning resources. Slips between departments, medical updates and best practices don't travel fast enough across wards and teams. The real cost of poor knowledge management. When knowledge is not captured or shared, the consequences are measurable and serious. First one, medical mistakes. Repeated errors occur because lessons from past incidents are never formally recorded or shared. Wasted training. The same training is delivered repeatedly because there's no record of who already completed it. Audit failures. Compliance gaps emerge when training records are incomplete or scattered across departments. Staff burnout. Teams carry unnecessary cognitive load when intuitional knowledge is not accessible. Now we are going to talk about the solution. How a LMS transforms knowledge management. A learning management system like Moodle give hospitals a single structured home for all knowledge, from onboarding to expert insight. First one place for all learning materials, automatically track staff training compliance. Record expert knowledge in video format. Accessible 24 hours, 7 days, 24/7 for day and night staff. Consistent training across all. Why Moodle works for healthcare? Free and low cost. That means open source and budget friendly for healthcare organizations of all sizes. Second one, secure and compliant. Role-based access controls protect sensitive training and patient-related content. Third one, mobile first. Staff can learn on the go, even offline from any device. Fourth one, skill tracking. Monitor competencies, certifications, and training progress in real time. Fifth one, interactive learning. Quizzes, simulations, and video content make training engaging and in here key Moodle features for hospitals. Online quizzes, test, knowledge and compliance. Learning paths, the structured progression for each role. Certification and badges, recognize completion and competence. Discussion forums, share knowledge across teams. Mobile learning, you can learn anytime, anywhere, even offline. Video library, you can record expert procedures and documentations. Built for varieties of hospital work. Moodle's features map directly to knowledge challenges hospitals face, from compliance tracking to capturing expert critical knowledge. Example, in practice, surgeons can review recorded procedures before complex operations. Night staff can complete mandatory training without attending in-person. Start small, build something that lasts. Knowledge saves lives, but only when it is shared. First one, identify knowledge gaps. Find where expertise is at risk, usually high turnover or specialist roles. Second one, digitize what you have. Convert notes, protocols, and training materials into a central system. Third one, pilot in one department. Start with one team, one course, one expert, prove it works. Expand hospital-wide. Scale gradually. Your LMS become the hospital's institutional. Thank you. I hope you got something for our webinar.